Thanks for this opportunity to speak. I was going to say a lot of what the previous two people have said, so I'll change what I'm going to say a little bit, but I have a ninth grader and a seventh grader that are becoming this fall. Based on my unscientific poll in the room, it looks like mask compliance is about 10%. So those of us wearing masks are following the recommendations of the Department of Health, the CDC, the American Academy of Pediatrics, the American Medical Association, the American Academy of Family Physicians, and the World Health Organizations. If the majority of us are choosing not to follow those recommendations, I don't think that we can expect our students to do any better. And for other things like the dress code, we saw the need to codify covering bare shoulders and stomachs because we didn't think that students and children were able to choose for themselves what was appropriate toward the school. But we're asking them to wear something like this just because if they feel like it. Masks only work when a substantial proportion of people are wearing them. Like one of the previous commenters said, it works both ways. And so it's not a personal choice like a bike helmet, it's more like a stop sign. And if people all of a sudden decide that it's my personal choice to not stop at those anymore, then we start to have problems. Some of the other commenters have talked about studies that have shown that either masks are not effective or they're dangerous. One of those that's been referenced is the JAMA study, which was retracted, and the Danish mask study, which was actually inconclusive in results, but is often misrepresented. In K through 6 settings where children often cannot be vaccinated because they're too young, or for people that have health conditions that preclude them from being vaccinated or make them high risk for complications, masks are the best tool to protect them, whether it be students, staff, or teachers. We've all seen what happens in other states where we're kind of a little bit behind, places like Florida and Tennessee, where that have already started the school year, and thousands of children there are already quarantining after only a few days. We need to do what is necessary to keep infections at a minimum and not simply see how fast we can get through this, hoping for the best. As we've seen school board meetings like this and other districts across the state and the country, it often reflects a kind of a patchwork approach that reflects more maybe the feeling of the community than the advice of medical experts. And I would encourage the board to follow the science, to trust the leadership of our public health organizations, and the examples set by other districts like Edina, Hopkins, St. Louis Park, Minneapolis, and St. Paul in requiring masks in schools. I think this is the only way that we're going to be able to ensure that we can keep the schools open, as well as the safety of our children and staff. As a parting note, my kids did full times. Okay? Thanks.